Good morning. It's Friday, May 21st, so it must be time for another legislative update from your North Carolina Medical Society. It's been somewhat of a quiet yet busy week this week down at the legislature. The House was gone mostly until Thursday. They came in for one vote, which I'll talk to you about. But the Senate was fairly busy, particularly on healthcare issues. So we did pass Senate Bill 172, additional COVID-19 relief and response. So this is additional funding for the COVID-19 pandemic, some funding provisions. Now, there are some health provisions included in this bill. This bill moved forward really quickly, almost in one day, and it got sent to the governor within the same day. So it really had a fast track to move. So be sure to check out those provisions that relate to healthcare on Senate Bill 172. That's located on our blog. You can see the full list and what's included in the bill. The next bill that moved this week was House Bill 947, the GREAT Grant Program expansion. So as a reminder, the GREAT program is great, but it's a broadband program that allows different companies to apply for grants to get broadband into our rural and underserved communities. So this specific bill would appropriate some funding and allow some more flexibility for those broadband companies applying for this program. So it expands upon the program that's already existed. The Medical Society's been supportive of this initiative to try to get broadband into those communities that need it most, for telehealth services, for your patients, and for educational purposes as well, and businesses. So excited to see this bill move and an emphasis on it. Next bill that moves, Senate Bill 257, the Medication Cost Transparency Act. This is the PBM bill that I may have talked to you about last session, or you may have heard us mention. This is a agreed upon bill by all the stakeholders for pharmacy benefit manager regulation. So some more regulation around those groups that control how medications are distributed. If you want to read that bill, again, also available on our blog, but it did make it through the Senate Commerce and Insurance Committee this week. Next bill is the one that got the most focus and attention, House Bill 395, HIE extension deadline. So this bill had a lot of robust discussion in the Senate Healthcare Committee early on this week, and we at the Medical Society sent you a survey, and it was included in your morning rounds, kind of based on those questions that we were hearing from legislators about why different providers were not connecting, what the barriers are, what the challenges still are, if some groups were deciding not to connect completely. So thank you so much if you took the time to participate in that survey. If you haven't or are unsure, we would love for you to forward that survey on to your practice manager, who may have some more of those answers for us, but that information is really helpful to us to share back with legislators some of your concerns about connecting or not connecting to the HIE. As a reminder, this bill would extend the deadline out for certain groups until 2023. For that full list of groups, please be sure to check out our legislative blog, as there were two different amendments on the Senate floor on this bill on Thursday. So be sure to check that out. And finally, I want to say thank you to the Western Carolina Medical Society, who hosted a wonderful legislative event, their White Coat Thursday evening event last night. It was great. As a reminder, you too can host a White Coat Wednesday, White Coat Thursday, White Coat Tuesday. Now that we have access to electronic methods to connect to legislators, they're comfortable using that technology. So please be sure to set up a time to meet with your legislators, either personally or with your practice or your county medical society. Building these relationships is incredibly important to the success of our work for you and for your patients. So please be sure to reach out to Michael DeSantis, who's our new staff member who is coordinating all of these efforts for us. That is all I have for you this week. I hope you have a wonderful weekend. Enjoy the sunshine, and we look forward to talking to you soon.